from Oshawa.
Thank you, Speaker. My question is to the Premier. People in my riding and across Durham region need to be able to count on our local hospitals, but this government keeps forcing our hospitals to cut frontline services. The forced merger of Ajax-Pickering Hospital with Lakeridge Health has a price tag of $18.2 million, but the province is refusing to foot the bill, and that means our local hospitals will be forced to find the money and forced to cut nearly $20 million out of frontline services and patient care. How on earth can the Premier defend deep cuts to hospitals in Oshawa and Durham that will only leave patients and families waiting longer for the health care that they need?
Minister of Health and Long-Term Care.
Thank you, Mr. Speaker. And in fact, the truth is we're investing more in our hospitals in Scarborough and Durham. I was there earlier this year with my fellow caucus members from both Scarborough and Durham. We announced in Scarborough a $20 million investment in a diagnostic suite for Scarborough Hospital. For Rouge Valley, we announced an increase of $5 million for the ER. We're making investments as well in the hospitals of both Ajax-Pickering and further to the east in the Lakeridge Hospital as well, and I'm very proud of the work that's been done over the course of the last year with the community and with specialists, with the hospitals themselves, to chart a path forward which will actually look at the health care requirements over the next couple of decades, Mr. Speaker, and that will no doubt result in significant capital investments, operating funds to go along with that to improve the health care of the individuals both in Durham and in Scarborough, Mr. Speaker.
Thank you. Supplementary.
Speaker, cutting health care and hospital services is what Conservatives do, but this Liberal government has a record of cutting just as deep. The forced hospital merger will cost over $18 million, but save just $300,000 per year. That means, Speaker, it will take 62 years to pay off the cost of this merger. And people inside the government are worried too, Speaker. At a community healthcare rally on November 5th, I was joined by the Liberal MPP from Ajax-Pickering who was there and who also wore a sign that said, "Save our hospital." Speaker, when will the Premier listen to families and seniors in my community and her own MPPs and stop cutting healthcare in Oshawa and across Durham region?
Thank you. Minister.
Thank you, Mr. Speaker, and I want to applaud the member from Ajax, who we have been working closely on this issue for a long time, and his leadership has resulted in a plan and a way forward for the hospital in Ajax-Pickering that serves that community as well as the broader West Durham area. His leadership has resulted in exceptional improvements and strengthening of the plan that was provided to me earlier this year. So I have to applaud his hard work. He's worked so consistently and has actually resulted, I believe, in delivering a great benefit to his local community, one that I intend on following through with, Mr. Speaker.